Hello, I'm Dr. Gates, and I would like to give you some information that I think that you may find useful when considering semaglutide, the recently approved weight loss shot. Semaglutide belongs to a class of medications that were approved for use in diabetics back in 2005. So they've been around for almost 20 years. Semaglutide specifically got its approval in mid-2021 for use in non-diabetics for weight loss. Semaglutide doesn't affect your blood sugar in a non-diabetic, and it's one of the primary reasons it was approved for use in non-diabetics, because it just doesn't affect your blood sugar level. Now, semaglutide's primary mechanism of action is through slowing stomach emptying, so it keeps you fuller for longer and it takes less to fill you up. This different mechanism of action is very useful, and there's multiple scenarios that I like to use and I've found semaglutide to be very useful in. One is when somebody has been using phentermine off and on or for an extended period of time, and they've developed some tolerance to it, so therefore it just doesn't give them the aid or sufficient amount of aid that it used to. Semaglutide in this situation is a wonderful addition to that treatment. Two, you've been dieting for quite some time. Not only do you have a little bit of a tolerance issue, but also you're getting tired of dieting and you need something to kind of help be more consistent and get that last 10 to 15 pounds off. Semaglutide has been excellent in that area as well. Three, you have a slow metabolism. Typically, you see this in the perimenopausal, menopausal time frame, and it's hard to get a sufficient calorie restriction to get any significant weight loss. Semaglutide has been especially helpful in this area of allowing the patient to really keep their calories tight and get that calorie restriction that they need. So those are a couple of scenarios where it's been very useful. The other neat thing is that since semaglutide works through a completely different mechanism of action than phentermine, you can combine them together and get possible treatment synergies there and do it safely because you're not stacking stimulants. Semaglutide is not a stimulant at all, does not interact in any meaningful way with phentermine, and is therefore safe to combine if we so choose, and we can use it that way as well. Now, be aware that semaglutide, because of its mechanism of action of keeping your stomach fuller for longer, can cause side effects that flow from that. For instance, because your stomach is fuller, it can cause an increase in reflux and heartburn. Because your stomach is fuller, in some patients it can cause some nausea as well, especially with eating or drinking. A typical scenario is that when getting started with the medication, a patient will experience a little bit of reflux, a little bit of nausea with their first shot or two, but that quickly abates. That's the majority of patients. You'll have some patients that aren't affected at all in any negative way from the medication, and you'll have a few that are more sensitive to it. These side effects can be treated easily with like Pepcid over the counter, just antacids. If the nausea were to get severe, we could certainly call something in for you. And I've only had to do that once so far with my patients. The dosing regimen that I can be increased and titrated up with treatment. So that's something that we can't do with phentermine once you reach that 37.5 milligram dose. But this medication, semaglutide, can be titrated up depending on your sensitivity to it to get to a dose that you respond to it. Semaglutide is a wonderful medicine. I would give it to all patients if it weren't so costly. And I understand that the cost of the medication can be a prohibitive factor when considering it. But it is a wonderful medicine. It is nearly universally loved by everybody who has tried it and can be a great addition to your treatment plan. So I hope this has been helpful for you considering it. And if you have any more questions, please bring them up during our consultation. Again, thank you.